Hello, my name is Dr. Noemi Spinazzi, and I'm here today to talk to you about the dual diagnosis of Down syndrome and autism. What is Down syndrome? As many of you know, Down syndrome is a genetic condition. It's caused by having an extra copy of the 21st chromosome in our cells. It is typically diagnosed at birth based on facial and body features or prenatally. And it's always diagnosed with a blood test. A blood test is a confirmatory diagnosis of Down syndrome. What is autism? Autism is a developmental difference. The causes of autism are unknown, while the causes of Down syndrome are known. It's an extra copy of the 21st chromosome. The causes of autism are unknown, although what we do know is that autism is not caused by vaccines. Autism is characterized by three main features. Number one, difficulties with communication, especially social communications and understanding and sustaining social interactions. The other category that describes autism is a restrictive and repetitive pattern of interests and behaviors. And then the third area is having difficulties with sensory integration. That means understanding what's coming in through our five senses: vision, hearing, smell, taste, touch, even the sense of our body in space and our sense of balance and the sensation of what we feel in our gut and inside our bodies, and integrating it, making sense of it, and feeling comfortable in the world. These are the three main characteristics of autism. Autism is typically diagnosed when kids are around 2 to 4 years old, sometimes later. And it is diagnosed using a full developmental evaluation. There is no blood test or other imaging test that can diagnose autism. Autism is a clinical diagnosis. So, can Down syndrome and autism happen together? Yes. We now know that a lot of people with Down syndrome can also have autism. It is very important to recognize when someone has both Down syndrome and autism so we can best support their learning. Today, I want to share some information about children with a dual diagnosis of Down syndrome and autism that was gathered in two ways. One, by reviewing all of the research articles that are out there on the dual diagnosis, and two, by sharing some original research that was done by myself and a work group that focuses on children with a dual diagnosis. I was done with a research survey that went out to families of children with both Down syndrome and autism. And we asked families a lot of questions about the early years prior to the diagnosis, their interactions with the medical and educational systems, perspectives on what interventions and supports were helpful, and reflections on how the diagnosis has impacted their family. Autism is common in people with Down syndrome. About 16% of people with Down syndrome also have autism. This is 1 in 6. It appears to be more common in males. It may be associated more often with some medical conditions, especially what we know is that kids who have a diagnosis of infantile spasms or epilepsy seem to be at higher risk for developing autism, although it does not mean that every person who has infantile spasms will develop autism. On testing, it is associated with lower IQ scores, and it can be associated with a family history of developmental issues. This is an ongoing area of very active research to better understand some of the epidemiology of this dual diagnosis. How do individuals with Down syndrome and autism present? Well, in our survey, we asked families, at what age do you start wondering whether your child was a little different from other kids with Down syndrome? And what they told us that it was around 3.5 years of age that families started to notice that their child was different from other children with Down syndrome. And when we asked them, at what age were you finally diagnosed? Families told us that on average, it was at 8.5 years old. So families do experience a long delay between the time they first develop concerns and the time that they finally reach a diagnosis. And this is important to know because it means that there's a lot of work for all of us in the Down syndrome community to more promptly recognize and support individuals who may have a dual diagnosis. Families may talk to other family members, to education and therapy providers, to their primary care doctor, or maybe to a medical specialist. Families may find that when they talk to educators, therapists, or even their primary care doctor, those individuals are not super knowledgeable about the autism diagnosis, and so they may be falsely reassured. And it is often a specialist who seems to have more knowledge about the dual diagnosis. How do children present? We asked in our survey, what were some things you noticed about your child that made you think that they were a little different from other children with Down syndrome? One of the things that they brought up is something called stereotypic behaviors. These can be things like repetitive behaviors like flapping, tapping, playing repetitively with strings and other things, or perseverative behaviors like playing with the same thing over and over in the same way, looking at the same thing like a fan over and over in the same way. What I do want to say is that children with Down syndrome can also have some repetitive behaviors. The thing is that kids who also have autism will do it more and will be harder to redirect away from those behaviors. Families also brought up abnormal play with more lining up toys and focusing on a part of a toy instead of the whole, and less pretend play and less playing with other kids, as opposed to wanting more to play alone with a toy. And then for older children, the practice of putting toys in the mouth is something that typically goes away over time and persisted for longer in kids with a dual diagnosis. Difficulties with social skills were often reported in kids with a dual diagnosis. It's important to state that kids with a dual diagnosis are still more social than kids with autism only. And so someone with Down syndrome who also have autism may quote unquote fool you because they look more social than someone you may know who only has autism. However, the interest in the social interaction is less sustained. There's less imitation. There's less calling of attention to what the kid is doing, which is called shared attention. And there seems to be less overall interest in socializing in kids with a dual diagnosis. What's really noticeable in kids with a dual diagnosis are difficulties in communication. And that is not only the speaking part, which we know is difficult in people with Down syndrome, but also things like gestures, uh, the way that our faces move to communicate things, sign language. If a kid is exposed to sign language, difficulties with using sign language and signs can also be seen in kids on the spectrum. Less pointing, um, and also some extra difficulties with receptive language. A lot of my families of kids with Down syndrome only will tell me, oh, my kid has a hard time speaking, but they understand so much more. My patients with a dual diagnosis typically have a difficult time both with what they say, but also how much they understand. So it's a bit of a mixed picture of expressive and receptive language difficulties. They may also show something called echolalia or stereotype speech, where someone may be able to repeat whole parts of a song, but then not be able to use simple words like mama or eat to request things. Sensory difficulties are seen commonly in people with a dual diagnosis. And so not wanting to play with touch type things, having a hard time in crowds or with loud noises or bright lights, not necessarily always wanting to be touched by others, severe feeding difficulties, significant difficulties with specific items of clothing. These can all be types of sensory difficulties. Poor eye contact was also reported by families in our survey. And what I would say here is that a lot of my patients with Down syndrome who also have autism will make eye contact, but the eye contact is briefer. The eye contact is less communicative. For example, if I do this and then look at something and then look back at you, you will want to look at where I'm looking because I'm trying to communicate to you, hey, look at that. And kids with Down syndrome who also have autism will not necessarily do that very much. That will not show that 3-point gaze. And they might give me a side eye, or they may check in with me but quickly look away, or they may focus more on my mouth than they do on my eyes. Some families may only recognize a slower achievement of milestones and notice that their kids with the potential dual diagnosis are progressing more slowly than other kids with Down syndrome. And that's especially true in communication, but also in adaptive skills like learning to feed themselves or leave the diaper. A lot of families reported a lot of mood and behavior issues, including tantrums, hyperactivity, impulsivity, self-injury, aggression, and anxiety, and being more difficult to soothe. And some kids actually presented with a developmental regression. So as take-home, kids may present to you as providers or teachers or therapists as just looking different than other kids with Down syndrome. Signs tend to be noticed by parents around 3 to 5 years of age, although a medical specialist might notice it sooner. Families may have a hard time getting their concerns heard. And symptoms reported are symptoms of autism, including repetitive behaviors, restricted patterns of interests, difficulties with socialization, significant language difficulties, as well as some mood issues like hyperactivity and anxiety. To evaluate, there is not a lot of evidence. We recommend the basics like a hearing screen and eye check, making sure we're up to date with our thyroid screenings. The MCHAT is a 20-point questionnaire that is easily available and is quick to fill out and can be a sensitive measure for cluing us into the presence of autism. We do recommend doing the ADOS, which is the Autism Diagnostic Observation Schedule, a very formal way of playing with a child that is coded by a psychologist and can help with the diagnosis of autism. And our expert recommendations are to do a variety of things, including a parent interview that's based on the ADIR, obtaining teacher information about how the kid is doing in class, as well as their interaction with peers, using things like the social communication questionnaires, the aberrant behavior checklist, a Vineland to look at adaptive functioning, as well as the ADOS. How do we help kids with Down syndrome and autism? Again, there isn't a lot of scientific evidence. We try to address what are the main challenges, which are the communication deficits, the rigidity, the difficulties with social skills, the mood and behavior issues, the dependency on activities of daily living. We try to set goals that have a long-term view, but a short-term achievable goal. One important intervention is called applied behavioral analysis, or ABA. It's a type of behavior therapy that uses visuals, repetition, and rewards to teach kids life skills and helps modify difficult behaviors. And if you want to see an example of ABA in a kid with a dual diagnosis, you can follow this link or look on YouTube, Down syndrome, autism, ABA, and you will find this video. Supporting communication is important, and that is not only speech therapy, but also using augmentative communication, whether it's pictures or PECs to communicate, or a higher tech device, so like an augmentative communication device, as you see here, or sign language, as all can be helpful in supporting someone's communication when there's a dual diagnosis. School needs to be very structured and using the 5 principles of TEACH, including a physical structure with a clear layout of surroundings that minimizes distractions, clear scheduling of what we're going to do and when we do it, and it should be presented in multiple ways. Work systems that clearly outline what is expected of the individual and how it will be accomplished and when it's over. And lots of visuals. Visuals are very important in supporting kids with a dual diagnosis. Medications do have a role, and my recommendations are to set clear goals for what the medication will help with, to start low and to go slow, and to see the doctor often as you're working on finding the right medication for your child. There are no medicines that take away autism, but there are medicines that can help with some of the behavioral symptoms, including the anxiety, the aggression, the hyperactivity. And this is a chart that can kind of go over some of these medications. So for take home, applied behavioral analysis can be helpful. Parent training to teach parents how to implement ABA type strategies can also be helpful. School needs to be structured. Remember to offer communication support. If you have one available, refer to a Down syndrome clinic and consider medication. So as my big recommendations, if you're a parent and you think that your child may have autism, list the behaviors you're concerned about, videotape them, seek out a formal evaluation. Don't necessarily take no for an answer. Think about common tools that are used to evaluate for autism, including the MCHAT and the social communication questionnaire, the Vineland, the ADOS, and then learn more about autism. There is a Down syndrome autism connection. That's an online support group that's freely available to join. And then there are books like When Down Syndrome and Autism Intersect, A New Course, A Mother's Journey in Navigating a Dual Diagnosis. The National Down Syndrome Society, as well as NDSC, have some resources online. And I want to acknowledge the Down Syndrome Medical Interest Group for their support in this work. Thank you so much for having me today, and have a great conference.